Is Jill going to come across? Yeah.
Jill's
well, thanks everyone. It's great to be here in Wagga with the Minister for Regional Health, Bronnie Taylor, West Fame member of the Upper House, as well as local member Joe McGurr, member for Wagga Wagga, and Jill Ludford, the CEO, Chief Executive of Wagga Wagga Base Hospital. And having the great opportunity today with my parliamentary colleagues to thank a lot of the health staff, the nurses, the doctors, the frontline staff who have been doing an amazing job during what's been an incredibly difficult period of time. Just heard earlier talking to some of the doctors and nurses that here in Wagga, when hospitals around the state have been under pressure dealing with COVID, to have the elective surgery backlog reduced to zero earlier this year is a testament to the staff here at the hospital. And the state continues to provide significant investment. Obviously, we had stage 3 of Wagga Wagga Base Hospital open this year, and then next year the car park, 900 spots, will be open as well. So we want to make sure that wherever you live in this great state, you have access to the best healthcare possible. It was just recently that Joe McGurr raised with me the concept, the idea of doing something here in Wagga like we've seen at Prince of Wales, at Westmead, in terms of tying in training, education, research, as well as healthcare into unified precincts. And we put some funding aside for the business case work based on Joe's advice. We provided that funding. I think that, if it works, will be a great blueprint for regional health right across the state. And I think Wagga Wagga is central to doing that. Make some comments today just in relation to some of the challenges we're seeing as we move through this period across the state, and also not unique here in Wagga Wagga, the same challenges with testing that is occurring at the moment. I want to thank everybody for their patience and the sacrifices they're making as we're moving through this transition period. I want to reiterate again the strong message that please only get a PCR test if you are required to do so. If you are feeling unwell, or if New South Wales Health has contacted you, or you are required to for interstate travel. We are still seeing many people in those queues who do not need to be there, and we want to get those queues shorter. We're doing everything we can. I spoke to, when I read reports this morning, the newspaper, of pregnant women having to line up in queues for testing. Well, that shouldn't happen. No one who is pregnant should be sitting in long queues. I spoke to the Health Minister this morning and asked him to fix it. My understanding is it is getting fixed today. But we will obviously have challenges as we move through this transitional period, and the government will continue to focus and change the settings and tailor them to where we need. Continue to have strong and constructive discussions with my interstate counterparts, the premiers in other states, in relation to this tourist testing, and continue to ask that it be removed. I want to thank Stephen Marshall for removing that test. It is clogging up the system. It is putting people in lengthy queues that are not necessary. And I note today that the Queensland government has removed that PCR test on day 5 once you've crossed the border. Well, we obviously would continue to ask here in New South Wales for our people who are going to Queensland on holiday. It's a great time of year. For the first time in a long time, we're able to see family again and holiday across the country. Please, can you reconsider that decision? Obviously, I continue to be in constructive discussions with Pathology in relation to that change. But if we can move that PCR requirement to a rapid antigen test requirement, that will significantly alleviate some of the pressure on the testing over summer. The other point I'd make is, right across the state, I want to thank everybody for the efforts they've made to get vaccinated, to be at first dose 95%. Here in Wagga, I think it's 98%, Joe, I think it's 98% first dose, one of the highest vaccination rates in the state, if not the country, right here in Wagga Wagga. And they're the efforts that protect people and protect our families from the virus. So I want to thank everybody for their efforts. As I've raised last week, booster shots, obviously, if now with the Atagi approval, are coming in at 4 months. So if it's been 4 months since your last second dose vaccination, you can go and get that booster shot. We ask that you do so as quickly as possible, particularly during this period of time. And if you look at where we're seeing right across the board, pharmacists and GPs, I want to thank them for the efforts they've made. Many GPs obviously go on leave over this period of time. I know many are making the effort to stick around to provide those booster shots. I want to thank them for that, and obviously acknowledge the work that the federal government and the Prime Minister has made in providing extra financial support for those doctors who are administering those booster shots. But also we've got 40 vaccination centres open right across the state to continue that work. So there are many avenues to get that booster shot 4 months into second dose vaccination. That's the protection we need to get through this next period of time. And I'm completely confident that New South Wales will get through this period. We have gone through the last 2 years. It has been incredibly difficult. There are naturally going to be inconveniences and challenges as we move through this next phase. We'll continue to work through those settings and adjust those settings where we can to alleviate pressure in the system. But we will get through this difficult time together. New South Wales will lead the nation out of this pandemic, and the best thing we can do is get vaccinated, get booster shots, follow the rules that are in place, treat everyone with kindness and respect, and New South Wales will continue the great work that our people have done in leading Australia out of the pandemic. I'm now going to ask Bronnie Taylor to say a few words in relation to regional health more broadly, and then Joe McGurr. Thank you.
Thank you very much, Premier, and thank you very much for having us all here today. It's wonderful to be here with you, Dr. Joe, again, and my colleague Wes Fang, and of course Jill Ludford, the fantastic CEO of Murrumbidgee Local Health District. But listen, I want to start by saying I'm very proud to be your Regional Health Minister, the first time that the state of New South Wales has had one. I take it very seriously. I spent 20 years myself as a registered nurse within the system, working in southern New South Wales as well. The system means something to me. I value it, but also I know what an incredible job you've all been doing. So may I start by saying, as your new Regional Health Minister, thank you. Thank you so much for everything that all of you have done. Thank you for your time today, to the doctors, the nurses, the ED staff for being here to talk with the Premier, Dr. Joe, Wes and myself. We really appreciate it. We really like hearing what's going on the front line. But most of all, we really value the work that you do and the contribution that you're making. We have one of the most outstanding health systems in the entire world, and the one in New South Wales has absolutely exceeded everything during this time. It has been amazing. I know it's been under pressure. I know how hard everybody has been working. But can we say thank you, and can we look at the incredible results that we've had? Your vaccination rates in this area speak volumes for the work that you've done on the ground, that frontline work to getting people vaccinated, to doing that. And just to echo the Premier's words, can I just say to everybody, let's make it your New Year's resolution to get your booster. Go and grab the jab, because that's what we know is going to make the difference. We know our vaccination rates have been strong, they have been high, and they have protected us. So please go and keep doing what you have been doing and get your booster vaccination as soon as you're eligible to have it, because that's what's going to keep you safe. But once again, thank you so much for all the incredible work that you've done. Thank you for having us at this magnificent facility. I mean, Wagga Wagga is a magnificent example of incredible infrastructure, but it's what's inside this hospital that makes the difference. And I can tell you right now, every single step of the way that we've taken today, we have felt that from every single clinician, from the security staff that you met at the door with, to the people on the ward, to the patients that are there that have sung the praises of the staff. It really emulates who you are. Thanks again.
Thank you very much, and I'd like to welcome the Premier and Minister Taylor, Minister for Regional Health. I think, Minister, this must be maybe your first visit to a facility as a Minister. It's great to have both the Premier and the Minister for Regional Health here today to showcase what has been achieved here in Wagga Wagga in terms of the infrastructure and the health facilities that we have, and to also show them what the potential is going forward from this. So we've got wonderful buildings here and wonderful staff. What we need to do, of course, is build on that, and the Premier mentioned that earlier in talking about the funding for the development of the health precinct. A health precinct like they have in Sydney, Prince of Wales, Westmead, which will train staff, do rural research, integrate our services, a model for regional health. And we're piloting that here and then we'll be talking to the Premier in more detail about that later today. But that is a really important initiative, very exciting, and it will lead the way in regional health, and having the Regional Health Minister here has been fantastic. Can I also say and add my thanks to the thanks of the Premier and the Minister to the health staff that have been working in our hospitals at the front line, and as the Minister said today, it was pretty clear from people that we've met how well received and how fantastic you are regarded, but thank you for your efforts. I also want to thank the community. The vaccination rates in Wagga Wagga are double vaccination rates, over 95%. Extraordinary, absolutely extraordinary, leading the state in many ways, and that will protect our communities. So thank you to the community. I do want to acknowledge the delays in tests that have taken place. We know that there have been long queues here in Wagga, and I know that that is frustrating. I just ask people to be patient. The Premier is very aware of the issue. It is not just an issue in Wagga, it's an issue across the state. The government is acting to try and fix that issue. There's a lot of pressure, of course, from people wishing to travel, which we understand. But I just ask for people's patience. The government is aware of that issue, and it is something we need to deal with. And we are finally, just to recognise, we are in a transition phase. We've had 2 years in which we have actually been very successful in protecting our community. First protecting it, then getting the vaccination rates up. We are ready now to move to another phase in which really we learn to live with COVID. That is a great achievement, particularly with the economy in the shape it is, particularly locally, I have to say, where we are booming. So on that note, I just want to ask the community, please get your boosters when they're due. Remember to take the sensible measures that have been brought in place in terms of mask wearing and QR coding, and we're looking forward to 2022. Thank you.
Questions? I've got some questions. Premier, obviously we've got people waiting 70 hours for their test results, lining up for hours to get the test. Some people even being turned away. Would you say the system at the moment is failing?
Well, New South Wales and Victoria are finding it very difficult at the moment because of the pressure on the testing system, and a significant proportion of that are these tourism tests. Now, I've continued my constructive discussions with the premiers right across the country in relation to that test. We wanted that to move to a RAT test. Now, the South Australian Premier has already moved that way, and I appreciate that decision. The Queensland Premier Anastasia Palaszczuk said that she'll move that to 1 January. She'll move towards the rapid antigen test. If there's any way we can bring that forward, we would appreciate it, because it is putting substantial pressure on the system. In addition to that, though, I really do want to reiterate that if you are not required to receive a test, if you are not feeling unwell, if you are not advised by New South Wales Health, there is no reason to be lining up for a PCR test. So I want to thank everybody for their patience. We are doing everything we can to alleviate pressure. The best thing would be if the state premiers removed that requirement. I note that in Queensland today they've removed that requirement on the other side of the border. It would put significant downward pressure on our system if that requirement was released on our side of the border.
We knew it was going to be a busy period in general. It's Christmas. Why weren't services bolstered in preparation for that?
Oh, the advice we have, we certainly put that work in, and the advice we have in terms of the capacity is this is the capacity. We're going through 150,000 tests almost every single day. Obviously numbers were down over the last couple of days, but we are close to, on average, 150,000 tests. That is well up from when last year or earlier this year, with the Delta variant, we were sitting around 60,000, 70,000 tests a day. So there is a substantial increase. We'll do whatever we can to alleviate that pressure, but the number one thing that can occur here is tests for asymptomatic people who are not feeling unwell simply because they are travelling interstate should be removed. And we've made that clear. It's putting significant pressure in Victoria and New South Wales at the moment in relation to our testing, and this will move around the country if we don't take a more common sense approach. As I said, when issues come up, I mean, earlier, if the stories today, pregnant women should not be sitting in queues. I made it very clear to the Health Minister to fix it. He's told me that he is fixing it today, and where else we can alleviate pressure on the system, we will. But we are moving through a challenging period of time, but we're in a very good position. We're in a much better position today than we were 12 months ago. As we open up, there will be challenges. We will need to change systems that are in place as we move through. But if we look today at the ICU numbers, if we look at the hospitalisation numbers, things are on track. As we opened up, we always said case numbers would increase. There are many challenges that are going to come our way over the course of this period of time, but New South Wales will stand strong. We've got through this last period of time. We're going to get through this difficult period of time as well, and I'm incredibly confident that the people of New South Wales will continue to make the sacrifices that are needed. I accept that there are challenges at the moment, and I want to thank everybody for their patience as we move through this phase.
And the addition that people should be more discerning about coming forward for
Yeah.
a PCR test that is then opted for the rapid antigen test.
Yeah.
Here in Wagga, a lot of pharmacies have reported selling out of rapid tests
Yes.
from the 23rd, and they're struggling to get stock in for the new year. Is anything being done to address this stock?
Yes, so obviously rapid antigen tests are available at pharmacists, but stock is obviously a challenge, not just here in Wagga Wagga, but right across the state. We announced that we will be providing free rapid antigen tests for people right across New South Wales. We've put an order in already for 20 million rapid antigen tests. My expectation is that they will be available by the end of January, and we are doing more in that space as well. So as we move into 2022, as we're living alongside the virus, taking personal responsibility, rapid antigen tests will be key. So they're not to be used, in circumstances where you're going down to the shops. These tests will be used for people going to high-risk settings, potentially going to hospitals, visiting elderly relatives, going clubbing. These are the types of environments where we would expect as we move through 2022 and we start shifting our focus again on how we're living alongside the virus. We have done everything in our state, right across New South Wales, by going out, getting vaccinated, getting boosted. Now is the time, as we've always said, living alongside the virus. Well, this is it. The time for talking about it is over. We are now moving through that phase. With this phase, there will be challenges, as we are seeing now, but we will work through it. We've got through the last 2 years. We'll get through this period of time as well. And I want to get as many rapid antigen tests in the homes of people right across our state. And I've made that point last week. And we'll obviously get that order coming in early next year, and we'll move through the best distribution model of those tests to ensure that people who need those tests have access to them. But it simply won't just be the state providing those tests, it'll also be through pharmacists and GPs and the like.
You mentioned a lot of these people getting tests are travellers heading to Queensland. We've been hearing that some people are going as far as getting international tickets just so that they're a priority in getting results back. Do you think it's fair that people are being pushed to such extremes?
No, I don't. This issue is not just unique in New South Wales. Victoria and New South Wales are going through this challenge right now. I want to thank everybody for their patience. These tourism tests, though, are putting substantial pressure on the system, and they're unnecessary. There are people getting tests who don't have any symptoms, are not feeling unwell, but are required to get tests and taking the place of people who are unwell or who are required to get a test from New South Wales Health. This is not the right approach. The right approach is to have a system where people who are travelling interstate, who are well, simply get a rapid antigen test, not a PCR test, and take the place from somebody who is unwell or has been advised by New South Wales Health they need a test. Now, I'll continue to work with New South Wales Health to see what we can do to alleviate pressure, but the reality is when people who are getting tests who don't need to get tests because they're not sick, that's going to put substantial pressure on the system. I've had very constructive discussions with the premiers. I'll continue to do that. I know the South Australian Premier has moved. The Tasmanian Premier the other day advised me that he was looking at the issue as well. So I think there is movement. But if we can remove the requirements for those PCR tests and move into rapid antigen testing, it's going to make the system move a lot quicker.
Premier, is the government considering turning people away who are getting these tourism tests, like what's happened in Canberra and
the ACT? Not at this stage. We have had discussions in relation to that, but not at this stage. We want to prioritise those people who are feeling unwell. there is just so many people lining up for tests because they're required to, because they're travelling interstate. Now, I understand what they've done in the ACT. We'll continue to monitor the situation and work through it. I want to thank everyone for, I just keep saying it, I want to thank everyone for their patience. There are people sitting in queues who shouldn't be sitting in queues. And if there wasn't this requirement for interstate travel, we'd have a whole lot of people not sitting in queues, and we have those sitting, getting a test, not having to wait as long. The situation needs to improve. I'll continue to constructively work with the premiers to resolve it.
Could some of this pressure perhaps been alleviated if those restrictions weren't lifted on December 15, or do you stand by that decision?
Absolutely stand by it. We have our pact with our people of our great state. Was get vaccinated, get boosted, and we move through. We are seeing case numbers increase all around the country. By learning to live alongside the virus, that means people who have made the effort, gone out and got vaccinated, above 95% first dose, we are moving to the next phase. We are not going back into a world of lockdowns. We are living, society is moving on, and the government has asked the people of our state to get vaccinated and return to normal society. Now, in the interim period, there will be challenges. There are restrictions in place in Victoria. They're having their case numbers increase and their testing numbers under pressure as well. That's just the reality of the situation that is in front of us at the moment. But we'll work through this. It's a difficult period of time for those who are getting tested. We accept that, but there's been difficult times over 2 years. Here in regional New South Wales, we've got through bushfires, we've got through drought, we've got through 2 years of the pandemic. We're going to get through this as well.
Have any regrets about going ahead with the reopening plan as it was developed under the Delta outbreak, seeing as we're now facing different conditions with the Omicron variant?
So what was the first part of the question?
Do you have any regrets going ahead with the reopening as it was planned under
No.
the Delta outbreak compared to now with the Omicron variant?
No, our plan is working. I sat in press conferences as we opened up, press conference after press conference, said cases are going to increase. And they were slow to get going. And the press kept saying, where are the cases, where are the cases? Well, here they are. Cases are increasing. That is exactly what was going to occur. What is more relevant is ICU presentations and hospitalisations. That is key. That is key to the focus that we have every single day. I cannot stress it enough for the press to stop the focus on new case numbers. Focusing on new case numbers does not provide substantial information to the public. What is most important as we move through this next phase is our ICU numbers, hospitalisation numbers. We made changes today for the close contact definition for health workers, which will bring in around an extra 1,000 health workers back into the system who'd been identified as a close contact. So, and that's for household contacts, down from 14 days to 7, and for those who aren't household contacts, to simply receive a negative PCR test on day 2, and that will bring around 1,000 health workers back into the system. But we're in a very strong position here in the state. We are opening up. We are learning to live alongside the virus. If you look right across the board, here in New South Wales, our death rate is one of the lowest in the world. We have a strong economy that's come through it. There are going to be challenges that are going to come our way, but I believe we've had the settings right over the last 2 years. I believe we have the settings right now. Curveballs will come our way as we go into 2022. We constantly monitor the system. Every single day we are looking at the challenges that we face. We are monitoring the hospital system here in New South Wales, in every LHD across the state, and we will tailor our settings where we need to.
So if this spike in case numbers was part of the plan, what's been the deciding to go back to masks and other restrictions?
Well, as we said, we would always tailor the restrictions to the circumstances that we face ourselves with. And 2 weeks ago, with discussions with the Commonwealth Chief Health Officer, our COVID and Economic Recovery Committee met, and we made what I see as modest and appropriate changes over the summer break with going back to 1 per 2 square metres for density limits. That's a very modest change. We're asking for face masks to be required over the summer period of time, and just also asking people to reduce mingling where they can. We think these are very appropriate settings for the circumstances that we find ourselves in. As we have said every day, in every press conference, myself alongside the Health Minister, if the facts change, the response changes. The circumstances change, we'll tailor our settings. If we need to tailor or target settings in certain areas, we will adapt those settings to suit the circumstance. But let's all be reassured right across our state, we are doing incredibly well. We have got through the last 2 years and we're going to get through this period. So, I saw the Shadow Health Minister out yesterday saying the New South Wales health system was at breaking point. Well, how utterly irresponsible. We don't need to be instilling fear in the community, but hope and optimism. And our health system is the strongest in the nation. It is not at breaking point. Comments like that from New South Wales Labor are irresponsible and reckless and immature in circumstances of the situation that we're facing today. Our health system remains incredibly strong. We're seeing other states close their borders around the country because they don't have faith in their health system. It's great to be here in Wagga Wagga to meet and thank many of the doctors and nurses, our frontline staff, who are doing an outstanding and amazing job in keeping people safe. Our focus is keeping people safe, learning to live alongside the virus. We'll tailor those settings as we move along, and we believe the settings we have in place strike the appropriate balance as we move through this next phase.
Speaking of the health system, more than 800 COVID-positive people were incorrectly told that they were negative. How worried are you about the knock-on effect of those people on case numbers?
Well, there'll be 800 cases that will be adjusted to those figures. My understanding, and still getting the advice from New South Wales Health, who are dealing with the pathology company, but my understanding is that those case numbers may have already been included in the case numbers that New South Wales Health has announced. What's important is mistakes like that from the pathologists don't occur again. What's the good news is it was picked up, and those people who were given that incorrect information have now been informed, and I know that New South Wales Health have been in contact and made it very clear that errors like that are unacceptable, and the understanding is that there are measures in place to ensure that that doesn't occur again, but ultimately as well what it also shows the checks and balances are in place to pick up when those errors occur.
Should there be then, to mitigate the risk of something like that potentially happening again, should there be calls for extra staff or longer working hours in these high pressure periods?
Well, we're working very closely with the pathologists to get those tests turned around as quickly as possible, but also they are working incredibly hard too. We're getting like 150,000 tests a day. In Victoria and New South Wales, our pathology teams, both within government and external, are doing everything they can. And I know it's tough. I know people are making enormous efforts in lining up in queues. And that's why I just want to continue to make the point, if you do not feel unwell, if you are not required to do a test, please do not line up and take the spot of somebody who is unwell or is required to take a test from New South Wales Health.
You mentioned the huge demand for testing right now. What's being done to support those staff members doing the swabs and working with the live streamers in light of increased demand, particularly in regional areas?
Well, look, everyone has made enormous sacrifices over the last 2 years and continue to do so. And we want to provide whatever support we can to New South Wales Health. We have invested, I said to Brad Hazzard at the start of the pandemic, whatever you need financially to get New South Wales through, you will have. It was an open checkbook and he took advantage of it. We put billions of dollars in to our systems right across the board. And I think that is, we laid strong foundations in this state, in our health system, over a substantial period of time, which I think the fruits of that are now coming to light. And that is that we have a very strong health system, whether you're in metropolitan Sydney or regional New South Wales. There's no perfect health system. There's no perfect health system. But I think New South Wales is as good as it gets. and we should be very proud of that effort. We don't just have the bricks and mortar, as Joe spoke about. It's the people, and Bronnie as well. It's our people. We have the best doctors, the best nurses who have worked tirelessly, and I know there is exhaustion, but we're going to get through this. We've got through the last 2 years. We're going to get through this too. I have complete confidence in the strength of our system, and that's why comments from the Shadow Health Minister yesterday are completely irresponsible, untrue, unfounded, and instill fear in our community at a time where there should be hope and optimism as we move through this difficult phase. You know, the Labor opposition have been talking a lot about a bipartisan approach to the pandemic, yet you have a Labor opposition health spokesperson saying the health system is at breaking point when it's not. We have a very strong health system, the strongest in the nation, the best nurses, the best doctors that are doing everything to keep our people safe. And in terms where hospitalisations and ICU presentations are stabilised at this time, we should be very confident as a people in New South Wales that we will move through this next phase despite its challenges and come out stronger the other side. Great, thanks. Any more? Okay, sorry, keep going. Keep going.
We're going to say moving forward to move out of this, we're going to need booster shots.
Yep.
Bronnie said it as well. But a man in aged care died because he didn't receive his booster shot. Are you concerned with the slow rollout of the booster program?
Boosters are key. It's very clear, the evidence is in, boosters are key. And we've changed that date now. So if you've received your second dose 4 months ago, you are now eligible. I received my booster shot 2 days ago out in the Homebush Vaccination Centre. There is capacity right now. We need people to go and make those bookings, but we're also seeing pharmacists who probably accounted for around 5% of vaccinations now going up to around 20% for booster shots. So there are more avenues to receive those booster shots. We want people to receive them as quickly as possible. There probably has been confusion in the community in terms of eligibility because that date has changed from the federal government, but it's now at 4 months. So what date is it today? The 27th? So 27, 28? 28? So it's a 28th. So if you received your booster shot on the 28th of August, you're eligible. So go and get your booster shot. It will protect you and your family. People have received vaccinations at record high rates. Now it's time to go that extra step, get boosters. That's going to be key to keeping us safe. And that's why people have concerns about opening up. Well, no. We should be completely confident as we move through this next phase because vaccination and boosters are we have one of the highest rates, not just in the country, but in the world. And that is key. That wasn't because of the government. That's because everyone across our state took personal responsibility. Personal responsibility in getting vaccinated and getting boosted has meant we can open up our economy as quickly but as safely as possible.
Premier, just on a lighter note to end really quickly, are you confident the Sydney Test match will go ahead in Sydney?
Yeah, absolutely. And any speculation the Sydney Test match is not going ahead is completely untrue. The Sydney Test is a highlight on our state's calendar. It is happening. I can't assure you how long it will last given what we've seen today. So try and get in on the first 2 days to see some action. But no, the Sydney Test is going ahead, no questions asked.
Thanks everybody.